Well, we try to make sense of the numbers and what they mean for the country's COVID-19 fight. We're joined now by infectious disease specialist, Dr. Benjamin Ko. Dr. Ko, thank you so much for joining us. We just heard about the increasing number of recoveries versus the number of deaths. If you break down all of this data, Dr. Ko, should we believe these numbers? Are they misleading, or are we winning the war against COVID-19?
Well, the point of saying that it is misleading, I think, is taken out of context. What the Department of Health data shows us is that these are the total number of confirmed cases, the total number of recoveries, and the total number of deaths, and they're just counting it. I think there is a discrepancy, and I agree with Beverly, Dr. Ho, from the Department of Health, in that there's a discrepancy in the counting because these are only for patients who are actually admitted, and these are not patients that are actually who are sent home on home quarantine. So we're missing out some of the patients there, and this is a large chunk. And I think if we have all of these patients all together, we may be getting different numbers later on with an increase in the total number of recoveries. If you also follow the natural course of illness, by this week and towards next week, we should be getting more recoveries, which is actually very good. Today we've had 8.29% case recovery rate compared to the 2% that we had in the last few days. So we're exceeding now the case fatality rates, which is very good for the country. Just a few comments is that I think what's happening also is that if you look at some of the data, there is a delay in some of the reports coming in, the reports of death. So patients are reported to, yes. Yeah,
so doctor, right now we're not really seeing the real story, but if we watch, we have to also watch very closely the high density areas, because we just reported earlier that Sitio Zapatera in Cebu City now has 135 infections, and that's more cases than any other place in the Visayas and in Mindanao. And this neighborhood has about 9,000 residents, and this is just one sitio. What if there are more, doctor?
Yes, that's true. That's very true. As a matter of fact, if you look at all of the data that's being provided, we can't just rely on number of cases, number of recoveries, and number of deaths. If you look at the demographics, for example, the total number of cases in Quezon City is 1,016 so far, with 83 recoveries and 70 deaths. So of course, we get alarmed by the fact that they are number one in total number of cases. But if you break it down according to the density of the population in Quezon City, they're actually number 5. And Muntinlupa has more deaths than Quezon City has. So the total number of case fatality rates, the highest is in Caloocan. They have 11% case fatality rates compared to Quezon City, which is just 6.4. And you're looking at numbers of, we need to remember that each of these cities have a difference in densities.
Okay, doctor, it seems like there are still a lot of knowns and unknowns in this whole COVID-19 fight. And now, of course, everyone is like talking about flattening the curve. In your view, are we close or far off from it? What is the exit parameter for COVID-19?
Well, let's put it this way. Once we've gotten all of the data in real time, we'll know whether we are flattening the curve or not. On an approximate basis, and the way we're going at it, currently, we're just basing it on the doubling rate, the growth rate. We seem to be doing well, I mean, compared to the other countries in the world. So we seem to be doing well. Let's not compare ourselves to Asia. I mean, if you look at our data compared to the U.S. or even to Europe, we're even way below the we're way below the case fatality rate of the world. we're at 6.5%, while the total world case fatality rate is 6.7%. So what I'm trying to say, what I'm trying to say is, once we've gotten all of the backlogs, and I understand that there are backlogs coming out from the testing centers. Once these come in and we've got real-time data, then we should be able to know whether we are actually flattening the curve or not.
Dr. Benjamin Ko, a pediatric infectious disease specialist from Asian Hospital, thank you so much for your insights.